Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hi, Minister. Thank you for having us again today.
Thank you for having me on the program.
Okay, Minister, I know yesterday would have been Independence Day, but the ministry would have also hosted its second COVID-19 vaccination drive-through. Despite the weather, what was the response like?
I think the response was really good because from the first one, we actually shortened the time. So this one was from 9 to 5, and we have seen more than 1,000 persons in that time span. In addition to which, as you rightly pointed out, we had really, really bad weather. At times, the tarmac had, I would say, about 2 inches of water. Nevertheless, I think people came out in their numbers. At no time did we have, um, you know, any space in between, so to speak. There was always a constant flow of people, and I think that's good. So we are encouraged by the response, and this is something that certainly the team would be reviewing. We probably would have more of these at the stadium. And we'll also be working with the different regions to see whether there are possibilities to do similar things in the various regions.
Okay. Minister, I know earlier this week you had mentioned that Region 6 was looking to do one, and if I understand correctly, Region 2 is also rolling out one this week as well.
I think Region 6 tried a mini version, and they told me yesterday they had a fairly good response as well. So we'll see how we'll develop it and grow it, and hopefully we'll get more people coming out. It really offers a lot of convenience because you drive up, you're in your car, you fill out the questionnaire, and then you go and you get your vaccines. So it's a really simple process. So we have to keep working on this. If this is one way that people are going to come out, well then we'll be willing to facilitate it.
Yeah, Minister, now still on the vaccination campaign, what are the numbers looking like right now?
I think the numbers are growing. Um, we have had 191,151 persons receiving their first dose. This amounts to close to 39.3% of our adult population. In addition to which, for second dose, we have had 62,610 persons who are now fully vaccinated. And this would account for approximately 12.9% of our population.
Okay, Minister. I know with regards to flooding, there have been several areas have been flooded out. What are some waterborne diseases that persons should be looking at?
Well, generally, because if water supplies have been contaminated, people would be drinking that contaminated water. A lot of times, because their sewage or their toilets can be flooded, it mixes with the water that probably they would be using to drink. So we have to make sure that if that is happening, that they get a better source of water. Some people have been capturing rainwater, and if you have rainwater, it also means that you can add bleach to the water. So whatever bacteria is in the water, you can kill the bacteria so that you get water that is not free from contaminants. In addition to that, a simple thing is to boil water. Once you boil it, it it would kill the bacteria in the water, and therefore, when you drink that boiled water, it's going to be safe. So, for those communities that have experienced flooding, I would urge that you take those extra precautions to keep your water supply safe. If you do that, then we'll see that we'll not see an increase in the diarrheal diseases, especially in children.
Okay. Um, are the health teams in the various regions continuously monitoring the situation?
Yes, we are. In addition to these like diarrheal diseases that we'll normally see, We're also on the lookout for skin rashes because people would be walking through the water. They can get skin infections. So that's another thing that we're on the lookout for.
Okay, Minister. Now I have some questions from the newsroom. They're saying that Guyana has now recorded 75 deaths in the month of May alone. They're asking what is the ministry's take on this, given the fact that we are engaged in an active, aggressive vaccination campaign, but yet the number of deaths are so high, as well as the number of infections that we've been recording daily.
Well, I'm not sure uh, what is it that they're trying to get. Vaccination prevents deaths. So vaccination is a way of reducing the burden of disease and also preventing deaths. So if you have more people being vaccinated, it would mean that we would reduce the burden of the COVID-19 infection in Guyana. And that's the reason why we have been saying and we have been working to achieve herd immunity. Herd immunity really means that you have a substantial portion of your population that is immunized. So if the infection is present, then the infection would be limited in its spread, meaning that it would not affect a lot of people. If you are vaccinated, it would mean that when you're exposed to someone who has the infection, you would not be able to get it, or if you get it, you'll get it in a very mild form. So, which means you would not be hospitalized, or you would not end up in the ICU and die from COVID. So, vaccination prevents deaths. So, the more people that get vaccinated, then the faster we can prevent the deaths that are currently occurring. So, I hope we can get more people coming out and getting their vaccines.
Minister, secondly, they're asking, there has been a noticeable spike in the number of infections in regions 8 and 9. They're asking if the spike is attributed to the flooding.
Again, flooding only started a couple days ago, and the context for those floodings are very specific. In one instance, it's because of the floodwaters coming out from Brazil, coming through the Takatu, and because of that, some of those communities near the Takatu would have experienced flooding there. When you have floods like that, the tendency is that people would congregate. And in those circumstances, if someone is infected, then they can transmit. And if you're not following protocol, if you're not wearing masks, and doing all the public health measures that we've been talking about, then obviously you can see an increase in transmission. So that's something that we're on the lookout for. Similarly, in Region 8, you would have had heavy rainfall. And in those flooded communities, again, if people are clustering and not taking the precautions, then obviously we would be able, we would see an increase in cases. So again, not because we have rain and flooded conditions, it would mean that we can abandon the measures that we are taking for COVID-19. COVID-19 is very much present. It would continue to be around unless we are all vaccinated. So if we're not vaccinated, we still have to take those precautions. And even if when we are fully vaccinated, because there's still others who have not taken the vaccine, we'll still have to take the precautions.
Okay, Minister. Now, before we go, I have a myth. Women who are menstruating should not take the vaccine.
Well, there's no contraindication for menstruating women not to take the vaccine. Um, I'm not sure why that would be circulating, but menstruation is a physiological thing that happens with women, and there's no reason why you shouldn't go and get your vaccines. I'm sure that for the thousands of people who we've immunized, Maybe some of them were menstruating, but we didn't have a problem. So there's no contraindication for a menstruating woman uh, coming to get vaccine. There's no contraindication why we shouldn't give her the vaccine. So we have been giving the vaccine, so please come.
Okay, thank you very much, Minister. Thank you for your time today. This has been our COVID 19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.